Words are tools. They can build bridges, they can build walls. When leaders, scientists, anyone in power uses words that most people don't understand, they are building a wall. It's a wall between vital information and the people who need it to survive. Think back to early 2020, a word popped up that most of us had never heard in our lives: asymptomatic. It sounds like something you'd find in a very serious textbook, right next to words like photosynthesis, mitochondria. Suddenly, it was everywhere. On the news, in government briefings, on social media. But here's the thing, a huge number of adults, in America and around the world, read at a basic level. They're not dumb, they just haven't spent their lives memorizing the dictionary. A clinical word, like asymptomatic, is a showstopper. It's a full stop in the middle of a sentence that says, "This information is not for you." When the COVID-19 pandemic hit, search engines lit up with people frantically trying to figure out what this word meant. You could literally see the confusion in the data. People were trying to learn a new, critical piece of health vocabulary in the middle of a global panic. This wasn't just a pop quiz, it was a life-or-death exam. So, why are these hard words so dangerous? It's because they create a void, a silent space where clear information should be. First, many people just tune out. Imagine trying to assemble IKEA furniture. The instructions are in a language you barely speak. You try for a bit. Then, you give up and guess how the pieces fit. You end up with a wobbly bookshelf. Now imagine that bookshelf is public health policy. The silence from the confused public isn't agreement, it's a breakdown in communication. Second, when people don't understand official explanations, they gravitate to the easiest story. The human brain is wired for simplicity. We prefer narratives that are easy and intuitive, even if they're detached from reality. A scientist explains viral transmission with technical terms. Someone else says, it's all a hoax. Which message is easier to digest? The simple dramatic lie often beats the jargon-filled truth. It's not a fair fight. The truth is competing with one hand tied. Third, some leaders exploit this gap. They keep the public confused to control the narrative. They say, see, the scientists keep changing their minds. Of course, science evolves as new data arrives, but without the initial vocabulary, changes sound like lies. This erodes trust in science, medicine, and government. Manufactured confusion becomes a political tool. It reframes a health crisis as a political battle. It's no longer about a virus, freedom, government overreach, a conspiracy by the elites. Hard words become proof of a secret club of experts pulling a fast one. The jargon-created void becomes fertile ground for division and distrust. Once trust is gone, it's incredibly hard to get back. Everyone is more vulnerable the next time a crisis hits. Once that void exists, the hijackers move in. They have a playbook, and it works disturbingly well. The first move is the classic flip-flop accusation. Science is a process of discovery. We learn more, so the advice changes. Maybe at first we don't know if a virus spreads through the air, so the advice is to wash your hands. Later, we find out it's airborne, so the advice becomes wear a mask. To a scientist, this is progress. But to an opponent who knows the public is confused, it's a golden opportunity. They can shout, first they said this, now they say that. They don't know what they're doing. It makes experts sound flaky and unreliable. The second method is the false definition. If a large portion of the public doesn't know what a word means, you can just give it a new, more convenient meaning. With asymptomatic, some people started saying it just meant healthy. Split-screen cartoon. Left doctor says asymptomatic transmission. Right politician tells a crowd they want to punish healthy people. They'd argue, why are we locking down healthy people? This makes no sense. Section 4. Measuring the gap. The data behind the confusion. This isn't just a feeling or a theory. You can see the evidence in the numbers. Decades of research have shown that many developed nations have a significant portion of adults with low health literacy. This isn't a measure of intelligence. It simply means difficulty understanding and using health-related information, often because of complex terminology used by doctors and public health officials. For instance, in the United States, only about 12% of adults have proficient health literacy. That means nearly 9 out of 10 people can have trouble with things like reading a prescription label, understanding a doctor's instructions. Before 2020, almost no one was Googling asymptomatic. Then, in March 2020, search interest jumped to the max. This data point illustrates a nation, a world cramming for a test they didn't know they had to take. Millions learned a critical concept not from a trusted doctor or a clear public service announcement, but from a search bar under immense stress. We can't draw a straight line from a Google search to ignoring advice, but the picture is clear. A giant information gap at the worst moment. Section 5. Closing the gap. 3 simple fixes for a big problem. So, how do we fix this? The good news is that it's not that complicated. It doesn't require inventing a new technology or spending billions of dollars. It just requires a little more thought and a little less ego. First, we need to embrace readability checks. There are free tools that tell you what grade level a text is written at. Before any public message goes live, run it through one of these tools. If it comes back with a high score, it's not ready. Rewrite it. Use shorter words. Use shorter sentences. The goal should be to communicate, not to impress. Instead of saying, "We are monitoring for evidence of asymptomatic transmission." Try this. "We're checking if people who feel fine can still spread the virus." See? Same idea, different words. One is an invitation to keep listening. The other is a reason to change the channel. This isn't about dumbing down science. It's about wising up our communication. Making information accessible is one of the smartest things we can do. It's a sign of respect for the audience, and it's far more effective at getting people to do what needs to be done. Second, focus on plain language translation from the start. For every technical term, add an immediate, simple explanation. Better yet, lead with the simple explanation. Instead of starting with the jargon, start with the action. Don't just say social distancing. Say, stay 6 feet apart from others. The first is a concept. The second is a clear instruction. The instruction is what saves lives. Have 2 versions, one for peers, and one for the public, and use the public version with the public. Third, frame the message with shared values. Data and facts matter, but emotions and values move people. Protecting your family, keeping our children safe, helping our neighbors. It's harder to twist shared responsibility into an attack on freedom. It reframes the debate around a shared sense of responsibility. Section 6. Your turn. A call for clarity. Ultimately, fixing this language gap is a job for everyone. It starts with our leaders. It starts with our scientists. It starts with our journalists. They have the biggest platforms. They have a responsibility to use them wisely. They must choose to speak and write with clarity. Before any public statement, ask, will my grandmother understand this? Will a teenager understand this? If the answer is no, go back and simplify it. Plain words do not weaken science. Plain words amplify science by making it accessible to everyone. When people understand, they can act. When we all act together, we are stronger. But we can't just wait for them to change. We, the public, have a role to play. We can create demand for clarity. When you see a word you don't understand, ask for a simpler explanation. If you figure it out, share it. This isn't a small issue. Language can make a community come together in a crisis, or it can tear a community apart. Language can lead people to follow life-saving advice, or it can lead people to fall for a dangerous lie. Remember when a word like asymptomatic was left unexplained? We saw confusion. We saw distrust. We saw division. We paid the price for that failure in communication. It was steep. We cannot afford the same mistake again. There will always be a next crisis. So let's make a commitment today. May 29th, 2026. Let's demand clarity. Let's practice clarity ourselves. Let's choose leaders who speak to us, not down to us. Building a culture of clear communication isn't difficult. It takes a little extra effort. It takes a little more empathy. It takes a decision to put understanding above all else. Let's start that work now, before we need it most. Next time a crisis comes, let's make sure our most powerful tool, our words, build bridges, not walls. People will thank you for it, and more importantly, it will work.